Hey, everybody. Great to be back here with you again today. I'm Leslyn Keith with the Lipedema Project. I'm president of the board and director of research, and I get together with you twice a month, usually the first and third Thursday, to talk about the research updates and all the different papers that have been coming out. As you know, there's been a lot of them, and it's hard to pick and choose what to talk to you about. I got a lot of papers in my folder waiting to come out and talk with you. So today I've got a paper the name of the paper is Frequency of Lipedema in Patients Consulting a Vein Clinic for Mild to Moderate Superficial Venous Disorder with Symptoms, a Retrospective Analysis. And you may have noticed the way that lipedema is spelled in the title of this paper with an O in there before the E. That's the European way. So this is a paper out of Europe. This is a couple of physicians in France who wrote this paper. And it was published in the Journal of Vascular Medicine in April of 2023. And so what they wanted to do, if you can't tell from the title, because it is a little bit convoluted, but what they wanted to do is to see what the frequency of the patients that were coming to them, female patients that were coming to them for vascular issues, how many of them had a comorbidity of lipedema, or maybe their issue actually was lipedema and they didn't really have a venous issue. So they wanted to see how often they were getting these kind of patients that coming into their office. And the paper, the authors specifically comment that because lipedema remains largely under-recognized and misdiagnosed, it's important to know how often patients with lipedema are coming to vein clinics. This may be their first place that they go for help for their legs. And so what was the design? How did they look at this issue, answer this question? It was a retrospective single center study. So meaning they looked at the files of a single vein clinic there in Grenoble, France. And they looked at all the charts from May 2020 to May 2021. So all the patients that came in that met this specific criteria, and they had a certain inclusion and exclusion criteria, certain age range and stuff like that, that they used to pick out the certain patients they would look at. And it turned out to be a total of 464 patients. So a nice, good sample size. So let's look at some of the results. When they look back through all of these charts, what did they find? The main result was that 7.7% of those patients, the 464 patients that were presenting at the vein clinic, had lipedema. And it was even more frequent than having lymphedema, because it's very common that you have swelling in your legs, you go to a vein clinic, and that could be lymphedema. But that was only 3.3% of the patients in this study. So in looking at real numbers, lipedema was 36 out of the 464. Lymphedema was 17. There was 14 patients with obesity, and the people that had chronic venous insufficiency, a mild venous issue, that was the bulk of the people in that group of 397 patients. And when the average age of all of those patients was 58, average BMI was 27.8. And when we break it down by those four conditions, lipedema, lymphedema, obesity, and chronic venous insufficiency, or CVI, and we look at the BMI associated with each of those conditions, this I thought was very interesting. The BMI for the lipedema group was 32, lymphedema was 31, obesity was 42, and CVI was 27. So the cutoff mark for obesity, if you're using BMI as the organizer of that, lymphedema and lipedema had very similar BMIs. Obesity had a much higher BMI, and CVI had the lowest. And what was interesting, this seemed to correlate with the leg circumferences. When they had taken those circumferences of the legs, they often do that because they're presenting with some kind of leg swelling and pain issue. So they had all those measurements. And again, the lipedema and lymphedema legs of those patients that had those two conditions, very similar and kind of in the middle ground, because obesity had the largest legs and CVI had the smallest. And I think that we're used to, with lipedema, because we have that disproportion in the lower body, we're used to that the legs for lipedema seems to be bigger than obesity. Not in this group. Obesity had the largest size legs. And then just looking at those 36 patients that had lipedema, they then got put down some further detail about what were the characteristics, what was going on with these individual patients, those 36 patients. And so they were looking at specifically their symptoms of lipedema. And 100% of them had that disproportionate fat distribution on the lower body. And they had difficulty with weight loss. They couldn't lose any weight. So 100% of the patients with lipedema had those two characteristics. And then pain and easy bruising was 64% of them. And then this is another, I think, goes with pain. Sensitivity to touch, 94% had sensitivity to touch. So we look at the other one, easily in pain, and it was only 64%. Well, I think the sensitivity to touch is kind of that pain issue. 94% had fatigue. 100% were not able to reduce the pain in their legs just by elevating them. And if it's strictly a vascular issue, elevating your legs does help with reducing the pain. And the cuff sign. So remember that when there's an abrupt stop to the size of the leg or the size at the wrist, it's called a cuff. And 44% had that. And 83% had pain with palpation. So you're pushing into the tissue, touching the tissue, and that hurts. So the pain and the swelling seem to be the two biggest issues. Onset of lipedema in those 36 patients. This was really interesting. As we know, we look at those periods of puberty, pregnancy, and menopause as the most common period. And all the recent papers I've been looking at, as this one also is the same, puberty seems to be by far the most common age of onset. And so 47% had that, only 8% at pregnancy and 5% at menopause. One person reported its onset with her ovarian surgery. And this is something that we're looking at, that we're getting anecdotal reports. Any kind of abdominal surgery seems to be a trigger period. And we're not getting a whole lot of reports of that, but this one did have one person who said that it seemed to start when she had the ovarian surgery. A full 35%, it was unknown, and they may not have asked the person, because remember, this is just a chart review, so that question wasn't asked, and so it wasn't not in the chart. So we didn't know for 35% of them. Other comorbidities, 20% of them had varicose veins, which is a more severe issue than mild chronic venous insufficiency. So you had to have some kind of venous insufficiency to be, and that was a criteria for being in the study. Only 20% had a more severe condition. 28% had high blood pressure, and 14%, or 5 out of the 36, had diabetes. And as we know, in a lot of studies, it shows that there seems to be a low incidence of diabetes. I'm sorry, I'm going to go over to my comments just in case people are saying stuff and I'm missing as I'm reporting on this paper. Hi, Julie. Nice to see you here. Marianne says, my mother, one of my sisters as well, myself, suffer from the disease and work support stockings throughout my career as a nurse. And that is, any of those standing careers where you're standing for a long time, people tend to wear support stockings. And if you have lipedema, you really need to use that when you're standing so much. Marilyn is in the Pacific Northwest and it's 41 degrees right now. And so thank you guys for all posting and saying you're here. Sherry does say that her lipedema became worse after her hysterectomy. Again, this is something we need to start gathering that data on, because I do think that that abdominal surgery may be a triggering period. So back to the paper. So we have the basic outcome of the study showed that 7.7% of the people presenting, because they had pain and swelling in their legs, they actually also had lipedema. And so the conclusion that these authors come up with is that lipedema is not an uncommon disease in patients consulting for symptoms of venous insufficiency. And so they say that they really feel like vascular specialists need to be made aware of this so that they can then give a rapid and appropriate referral for treatment of that condition of lipedema. And the authors always also say that a vein clinic may be what they call a gateway for getting a proper diagnosis. And so again, this makes it really important for vein specialists to be aware of the diagnosis of lipedema, because it may be the first place that a person with lipedema goes to find answers. Why are my legs painful and why are they swollen? Among maybe other symptoms that they're having, but those seem to be the ones that drive them to a vein clinic. And he said, the author said also that the most common thing for when you really do have a vein problem is pain and swelling. So it's logical that they would go to a vein clinic. And so we need to make sure that these vascular specialists know about lipedema and know how to make a diagnosis. And then they also comment, as many other papers have commented, it's challenging to diagnose lipedema. And so even if you are aware of, peripherally kind of aware about lipedema and are not really an expert in it, but are aware of it, it can still be really confusing to diagnose because it often occurs along with other things that are similar to it. For instance, obesity, lymphedema, and various vein conditions. So now it makes it really even more difficult to diagnose because there's more than one thing going on. So, and then they said they really called for that we need a, quote, clearly defined set of criteria to support a diagnosis. This is another thing that makes it confusing because there's so many different opinions on what constitutes lipedema. And so they really feel that it's mandatory for getting an accurate diagnosis, especially if you're going to do a research study, as they were doing. This was their study of all those charts and then the reporting on it. You have to be very clear about what you're saying is lipedema. And so I'd like to give you a heads up that we at Lipedema Simplified have Lipedema Project. We have written a paper just about this, and it is under review and hopefully will be coming out in early 2024 that clearly defines what is and what is not lipedema. So hopefully that's going to help, especially for research. One limitation that they did report of this particular study was that it was only from a single clinic. So it was just this one vein clinic in Grenoble, France. And so they said you really can't generalize it to everywhere with lipedema, but this is what we found in our clinic over a year. And but I still say this is a very important paper for people with lipedema because it adds that valuable information to that knowledge base. And even for someone like a lot of you who are watching right now, who are pretty much an expert in their own body and what's going on with their lipedema, this still adds more information. And then it's drives home that we need to get the medical providers out there, particularly at vascular clinics, we need to get them up to speed about lipedema so they can more accurately see that, okay, this, among other things, lipedema is something that's going on. Where do I need to send this person for appropriate treatment? And we will need that to happen much faster than we've seen it happen in the past. I think a lot of you have reported, and I've seen in a lot of papers that, you might have noticed that something was different, something was going on at puberty. And now you're in your 40s, 50s, and 60s, and you're just now getting a diagnosis. That's too long. That's too long to wait. So we need to really increase the awareness in the general population as well as in the medical community so we can get that diagnosis much sooner and then get treatment much sooner. So that is the paper that I have for you today. I'm just going to do a quick check in your comments. Thank you all for putting in comments. Let's see. Marianne is looking into WAL, which is a type of liposuction surgery that's used for lipedema. Aileen from Puerto Rico is here. Hello. And also, I guess, Aileen, you're also saying that you also had a trigger from a abdominal surgery, possibly a hysterectomy, to start your lipedema. I'm just working on a research protocol right now, and I'm definitely going to add that question in there to make sure that we capture that information. I think it's so important. And then Marilee had to leave a job as a dental assistant because of plantar fasciitis and painful legs. So that's plantar fasciitis is painful feet and painful legs. And so, you know, it definitely interrupts your quality of life. It interrupts your livelihood. So this is something we need to have good treatment for it. And thank you, Sherry, for being here also. I have a couple of announcements for you. So let me talk about those, because one thing we have coming up in January 4th, I do believe, is going to be our town hall. This is going to be a recap of 2023, all the things we did, all the things you did, all the things we all did together. There was quite a lot of action, a lot of learning and education and increased understanding that happened in this year. And so we're going to recap all of that for you, but we're also going to be previewing what's coming up in 2024. And it's pretty exciting. The things that we have accomplished and the things that we intend to really work on in 2024. So save that date. I don't think we have a link for it yet, if I'm not mistaken. So just save the date, and that's January 4th at 6 p.m. Eastern time. And please join us. Remember also that when we do get out the link for you to register, if you can't be there at that time, still register, because then you will have access to the replay. You only get the replay if you registered. So be sure to sign up for that. And then another exciting thing that we've got going is that we are bringing Dr. Robert Perrin over from the UK. He is an osteopath that he has developed his own method of treatment called the Perrin technique, mostly focused towards chronic fatigue syndrome, but it really looks at the neurolymphatics, the lymphatics of the head, neck, the brain, and the spine. And we're finding that it might also be useful for people with lipedema who have chronic fatigue syndrome, fibromyalgia, or some of those other related conditions, but also people who may have issues with their central lymphatics. This may be a technique that helps. We've had a couple of our people that have central lymphatic issues experiment with it, and it seems to be helping. As you know, this is kind of a difficult condition to treat. And so we're always searching for stuff that's going to help with central lymphatic issues. But we think it also might be really good for lipedema and lymphedema. So we're bringing Dr. Perrin over. This is a workshop for practitioners, for your CLT, your certified lymphedema therapist, for an osteopath or a doctor or a nurse or other therapist that is just interested in learning this technique. But we do think we'd especially like to get CLTs in there, because that is the therapist that you, as someone with lipedema, might be seeing. So if you have a CLT that you work with right now, tell them about this, that they need to attend this workshop. We will have, I can't remember the date now, but it's in sometime in late January. We're going to be having a free webinar by Dr. Perrin that you can go to, and you can also send your CLT to find out more about this technique. And if maybe they want to see that free webinar to see if they actually want to take the workshop with Dr. Perrin. So you'll be getting more of that. That will be coming after the first of the year. Okay, thank you very much, Gail. The webinar is on January 24th. That is a free webinar for everybody. The workshop that's going to be held in Boston the first weekend in February 2024, that one is just for clinicians. So I'm thinking that is it for my updates here. Just another word about this article that I talked about today. We put the link in there for you so you can get that article. It doesn't have the whole article. It is, it's behind a paywall. If you want to read the whole article, email me here at leslyn@lipedemaproject.org. I can send you the PDF of the article. And that is also the email that you would use if you have other papers that you would like me to go through and review and report at this twice a month research updates, then contact me there also. I love to hear from you. And that is all for today. I really enjoy spending this time with you, and I'll probably see you again tomorrow for our another Facebook Live, just with our weekly updates. So see you then.